submandibular region and major salivary glands. Are 6 in number, 3 pairs. These are the parotid, submandibular, and sublingual glands. Because the parotid gland is not located in this region, it is not studied here. The submandibular gland is located primarily in the submandibular triangle, whereas the sublingual gland is located in the floor of the oral cavity, beneath the tongue. Submandibular region or suprahyoid region includes the region from the inferior border of the mandible to the hyoid bone. This includes some of the structures of the floor of the oral cavity, including those muscles that originate on the mandible and insert on the hyoid bone, as well as those that originate on the hyoid bone and insert into the tongue. The submandibular or suprahyoid region lies between the hyoid bone and the mandible in the anterior triangle of the neck. However, it is more often studied with the head because it is a transition zone between these two regions and because the structures contained therein function in association with the jaws and the floor of the mouth. Suprahyoid muscle group functions include those muscles that originate or insert on the hyoid bone and function on structures in the region. These would include, among some others, all of the muscles whose name ends in hyoid, i.e., stylohyoid, mylohyoid, geniohyoid, and the anterior and posterior bellies of the digastric muscle. Tongue muscles include both intrinsic-extrinsic muscles. The intrinsic tongue muscles, located within the tongue, include longitudinal, transverse, and vertical groups. These three groups function to alter the shape of the tongue when necessary for mastication, phonation, and deglutition. The extrinsic muscles whose names end in glossus originate from several anatomic sites and insert into the tongue to intermingle with other tongue muscles. The intrinsic muscles and 3 of the extrinsic muscles are innervated by the hypoglossal nerve, cranial nerve 12. The submandibular region and floor of the mouth are contained mostly within the submandibular triangle and the space spanning across the midline between them. Contained within this region are the suprahyoid muscles as well as the muscles of the tongue. 2 of the major salivary glands are also contained in this region. Muscles contained within the submandibular region and the floor of the mouth and/or forming its boundaries include the anterior and posterior bellies of the digastric, stylohyoid, mylohyoid, and geniohyoid muscles. Both intrinsic and extrinsic tongue musculatures, namely, the styloglossus, genioglossus, and hyoglossus muscles, also occupy the region. Strictly described, the middle pharyngeal constrictor muscle also may be included because it originates from the hyoid bone. The platysma, a muscle immediately deep to the skin, overlays this region. Cutaneous sensation to the area is provided by branches of the cervical plexus. Additionally, branches of several cranial nerves, include 1ng the trigeminal, cranial nerve V, facial, cranial nerve 7, and hypoglossal, cranial nerve 12, nerves, provide sensory, special sensory, motor, and secretomotor innervations to the structures within this region. The major vascular supply to the region is provided by branches of the lingual artery, but branches of the facial and maxillary arteries also contribute to its vascularization. Venous drainage is accomplished by like-named veins and the anterior jugular vein. 2 of the 3 major salivary glands, the submandibular and sublingual glands, occupy the submandibular and sublingual regions, respectively. These 2 glands receive postganglionic parasympathetic innervation from the submandibular ganglion located in the vicinity of the submandibular gland. The submandibular region is bounded superiorly by the inferior rim of the mandible and inferiorly by the anterior and posterior bellies of the digastric muscle, as these 2 bellies converge onto the hyoid bone to form the submandibular triangle. The mylohyoid muscle, spanning between the 2 sides of the mandible, is attached inferiorly to the anterior aspect of the hyoid bone. Its superior surface underlies the tongue, thus forming the floor of the mouth, whereas its inferior surface forms the floor of the submandibular triangle. Attached to much of the posterior aspect of the hyoid bone is the hyoglossus muscle ascending into the tongue. The interval between the mylohyoid and muscles contained within the submandibular region include the suprahyoid muscles and those attaching either to the mandible or to the hyoid bone. The tongue muscles are also included in this region, with the exception of the palatoglossal muscle, which originates from the palate and is innervated by the trigeminal instead of the hypoglossal nerve. The mylohyoid muscle forms the floor of this region. Muscles constituting the submandibular region and the floor of the oral cavity include the suprahyoid muscles of the anterior triangle of the neck and those attaching either to the mandible or hyoid bone forming the floor of the mouth and/or the tongue. Both intrinsic and extrinsic muscles of the tongue are generally described with this region, the exception being the palatoglossus muscle, which originates from the palate and is thus more appropriately described with muscles of that region. The suprahyoid structures are enclosed in the investing fascia of the neck. This fascia is attached to the hyoid bone and extends superiorly, attach 1 ng to the inferior border of the mandible. Enclosing the anterior belly of the digastric muscle, the investing fascia continues posteriorly and laterally to encase the submandibular gland. The deeper layers of this fascia envelop the muscles of the submandibular region, including those of the tongue. Fusing with the deep fascia of the posterior digastric muscle, the investing fascia assists in forming the stylomandibular ligament. The facial compartment containing these structures reaches the floor of the mouth, the sublingual gland, and the tongue. Clefts between the facial layers posteriorly, at the border of the mylohyoid muscle, into the lateral pharyngeal cleft and into the cleft around the submandibular gland. Suprahyoid muscles. Digastric muscle. The digastric muscle consists of two heads that originate from different locations, however both insert onto the hyoid bone via an intermediate tendon. These two heads, along with the inferior border of the mandible, form the boundary of the submandibular triangle. The digastric muscle consists of two portions, a posterior belly, which arises from the mastoid notch of the temporal bone, and an anterior belly, arising from the digastric fossa of the anterior lower border of the mandible. Both of these muscle bellies descend to the hyoid bone to be inserted by an intermediate tendon, table. A fibrous loop surrounds the tendon as well as the body and the greater cornu of the hyoid bone. At the loop, the tendon perforates the stylohyoid muscle at its attachment on the hyoid bone. The combined function of the two bellies of the digastric is to elevate the hyoid bone and also to assist in opening the mouth when the hyoid bone is fixed by the infrahyoid muscles. Acting independently, the anterior belly draws the hyoid anteriorly, whereas the posterior belly draws it posteriorly. Embryologically, the digastric muscle is really two separate muscles, each derived from different pharyngeal arches. The anterior belly originates from the mandibular arch, pharyngeal archi, and is innervated by a branch of the mylohyoid nerve from the mandibular division of the trigeminal nerve. The posterior belly develops in the hyoid arch, pharyngeal arch 2, and is innervated by a branch of the facial nerve that enters its deep surface at mid-belly. The posterior belly of the digastric muscle is vascularized by the posterior auricular artery, with contributions from the suprahyoid branch of the lingual artery and muscular branches of the occipital artery. The anterior belly is vascularized by the submental branch of the facial artery. Stylohyoid muscle. The stylohyoid muscle originates from the styloid process of the temporal bone and descends to the hyoid bone in association with the posterior belly of the digastric muscle, which perforates it close to the insertion. The stylohyoid muscle arises from the posterior and lateral surfaces of the styloid process of the temporal bone. As this muscle descends to insert on the body of the hyoid bone, it is in close association with the posterior belly of the digastric muscle, which perforates it close to its insertion. The stylohyoid muscle functions to draw the hyoid bone superiorly and posteriorly, in addition to assisting in fixing it. Motor innervation to this muscle is provided by a branch of the facial nerve that enters its mid-belly. Vascular supply is provided by posterior auricular and occipital branches of the external carotid artery. Additional vascular elements may reach the muscle via the suprahyoid branch of the lingual artery and from muscular branches of the facial artery. Mylohyoid muscle. The mylohyoid muscle originates from the mylohyoid line on each half of the mandible and inserts upon itself in the median raphe to form the floor of the oral cavity. The mylohyoid muscle forms the floor of the mouth as it unites in the midline with its counterpart from the opposite side of the mandible. This muscle arises from the entire length of the mylohyoid line of the mandible, from the symphysis menti to the region opposite the last molar tooth. Anteriorly, the fibers of each side insert into a median raphe, whereas the more posteriorly oriented fibers insert into the body of the hyoid bone. The rhilohyoid muscle assists in depressing the mandible when the hyoid bone is fixed. When the mandible is fixed, the muscle elevates the hyoid bone, and consequently the tongue, for swallowing. The mylohyoid nerve from the inferior alveolar branch of the mandibular division of the trigeminal nerve innervates this muscle as the nerve approaches its inferolateral border. Vascular supply is provided by the anastomosis from the submental branch of the facial artery and the sublingual branch of the lingual artery. Geniohyoid muscle. The geniohyoid muscle origins superior to the mylohyoid muscle from the inferior mental spine of the mandible and inserts upon the hyoid bone. Immediately superior to the mylohyoid muscle is the geniohyoid muscle, originating from the inferior mental spine, genial tubercle, of the mandible before descending to the anterior surface of the body of the hyoid bone. At its insertion, the geniohyoid is in contact with its counterpart from the opposite side of the mandible. The geniohyoid muscle functions to draw the hyoid bone anteriorly and, in so doing, draws the tongue as well because some of the extrinsic muscles of the tongue are attached to the hyoid bone. The geniohyoid muscle is innervated by fibers of the first cervical nerve, which are transported to it via the hypoglossal nerve. Vascularization is provided by the sublingual branch of the lingual artery. Group actions. The suprahyoid muscles all originate from various areas superior to the hyoid bone, but all insert upon the hyoid bone, hence their names end in hyoid. As a group, these muscles assist in fixing the hyoid bone for swallowing and for retracting the mandible. They function in concert with the infrahyoid muscles of the neck. The suprahyoid muscles, all of which attach to the hyoid bone and another structure superior to it, function as a group to assist in swallowing by lifting the hyoid bone, the floor of the mouth, and the tongue. As food passes down the esophagus, the stylohyoid and posterior digastric muscles retract the hyoid bone to prevent regurgitation. This muscle group may also assist in fixing the hyoid bone and in retracting the mandible when the hyoid bone is fixed by the infrahyoid muscles. Tongue muscles. Intrinsic muscles of the tongue are confined within the tongue, whereas the extrinsic muscles originate from various places and insert into the tongue. The tongue muscles are composed of two groups, intrinsic tongue muscles and extrinsic tongue muscles. The intrinsic muscles of the tongue are confined within the tongue itself and are described as longitudinal, transverse, and vertical muscles. The longitudinal muscle group is subdivided into a superior and an inferior group. The intrinsic muscles function generally to alter the shape of the tongue as necessary in mastication, deglutition, and phonation. The varying shapes of the tongue can be predicted by relating the fiber orientations of the intrinsic muscles as named. The four extrinsic muscles of the tongue originate outside it, the genioglossus, hyoglossus, styloglossus, and palatoglossus muscles. Genioglossus muscle. The genioglossus muscle originates from the superior mental spine and inserts into the internal aspect of the inferior surface of the tongue. The genioglossus muscle arises from the superior mental spine, genial tubercle, of the mandible directly above the geniohyoid muscle. From here, the muscle fans out to enter the entire length of the inferior surface of the tongue. The most anterior fibers curve upward to insert into the tip of the tongue. The posterior fibers pass to the base of the tongue, whereas some of the most inferior fibers are attached to the body of the hyoid bone. The genioglossus muscle acts to protrude the tongue, whereas the most anterior fibers depress the tongue tip. Hyoglossus muscle. The hyoglossus muscle originates from the hyoid bone and passes vertically to insert into the tongue. The hyoglossus muscle originates from the side of the body and greater cornu of the hyoid bone, passing vertically to enter the tongue, where the fibers intermingle with those of the styloglossus muscle. A separate slip of muscle, referred to by some as the chondroglossus muscle because it is separated from the hyoglossus by a small interval, is considered a part of the hyoglossus in this text. The hyoglossus functions as the major depressor of the tongue. Styloglossus muscle. The styloglossus muscle originates from the styloid process of the temporal bone and inserts into the tongue on its lateral surface to intermingle with fibers of the hyoglossus muscle. The styloglossus muscle arises from the anterior surface of the styloid process of the temporal bone and the stylomandibular ligament. It then descends anteriorly and medially to enter the tongue from the lateral aspect, as it turns horizontally. Most fibers of the styloglossus muscle continue onto the tip of the tongue. Some of the posterior fibers decussate with those of the hyoglossus muscle. This muscle functions to retract the tongue, whereas the more anterior fibers elevate the tip. Innervation and vascularization. All of the muscles, extrinsic as well as intrinsic, of the tongue, with the exception of one, are innervated by the hypoglossal nerve, cranial nerve 12. The palatoglossal muscle, which originates from the palate, is innervated by the pharyngeal plexus. Vascular supply is provided by branches of the lingual artery, again except for the palatoglossal muscle, which is vascularized by arteries of the palate. All of the tongue musculature is innervated by the hypoglossal nerve, with the exception of the palatoglossus, which is innervated by the pharyngeal plexus. The vascular supply to the muscles of the tongue is provided primarily by the deep lingual artery, the terminal branch of the lingual artery. The exception, again, is the palatoglossus, which is served by the arteries of the palate. Lingual cancer. Cancer of the tongue is the most common cancer of the oral cavity, 36.2%. About 95% of the cancers located on the tongue and floor of the mouth are squamous cell carcinomas that are correlated with a history of high use of alcohol and tobacco. 2/3 of the tongue cancers occur on the lateral surfaces of the middle third of the tongue, whereas 1/3 are located on the ventrolateral or the anterior undersurface of the tongue. Malignancy in the posterior portion of the tangui metastasize to deep cervical lymph nodes early on, whereas those on the anterior part of the tongue do not metastasize to the deep cervical lymph nodes until later in the disease. Thus, because the deep cervical lymph nodes drain into the internal jugular vein, it is extremely important that the disease be identified and treated as early as possible to prevent metastases into structures within the neck. The extrinsic tongue muscles generally function to direct the movement of the tongue, example retract, protrude. All tongue movements are the result of coordinated contractions of several intrinsic and extrinsic muscles. Complex movements of the tongue are accomplished by intricate and coordinated contractions of both intrinsic and extrinsic muscles of the tongue. Generally, movements other than those that basically alter the shape of the tongue are the result of contractions of the extrinsic muscles, although one group seldom functions alone. The overlapping, intermingling, and decussating nature of the intrinsic and extrinsic muscle groups permit the fine coordinated effort so necessary to speech. Salivary glands. Two of the three major salivary glands, the submandibular and sublingual glands, are located in this region. Both empty their secretions into the floor of the mouth. Two of the three major salivary glands are located within the submandibular region or in the floor of the mouth, the submandibular and sublingual glands. The third major salivary gland, the parotid gland, is located on the side of the face and in the retromandibular space. Most of the submandibular gland is located superficially in the submandibular triangle, with only a small portion extending into the floor of the mouth. The entire sublingual gland, however, is housed in the floor of the mouth. Submandibular gland. The submandibular gland is located mostly within the submandibular triangle and in the submandibular recess, a region situated on the medial surface of the mandible. The submandibular duct extends to the sublingual caruncula, where its contents are emptied into the mouth. The submandibular gland occupies much of the space within the submandibular triangle. Superficially, it is covered by skin, platysma, and the superficial layer of the deep cervical fascia. The superior extent of the gland is recessed under the cover of the mandible in the submandibular fossa. Inferiorly, the gland extends to the hyoid bone, overlapping the intermediate tendon of the digastric muscle. The gland extends anteriorly to the anterior belly of the digastric muscle and posteriorly as far as the stylomandibular ligament. The deep surface of the gland lies on the hyoglossus, stylohyoid, styloglossus, and mylohyoid muscles. Usually, a finger-like projection extends into the sublingual space on the superior surface of the mylohyoid muscle. It is from this deep process that the submandibular duct, the Wharton duct, emerges to pass anteriorly between the mylohyoid, hyoglossus, and genioglossus muscles, then between the last named muscle and the sublingual gland to open onto the sublingual caruncula, just lateral to the base of the lingual frenulum. The facial artery vascularizes the submandibular gland as that artery passes through the gland's posterior portion on its way to the superficial face. The artery ascends across the lateral border of the mandible just anterior to the masseter muscle. The sublingual branch of the lingual artery also provides additional vascular supply to the gland. Venous drainage follows the named arterial channels. Sublingual gland. The sublingual gland is located beneath the anterior aspect of the tongue. It lies superior to the mylohyoid muscle and is covered by the sublingual fold. The gland lies in the sublingual fossa of the mandible and is bordered medially by the genioglossus muscle. Saliva is delivered by tiny excretory ducts onto the floor of the mouth, although some ducts join to form a sublingual duct that empties into the submandibular duct. The sublingual gland, the smallest of the three major salivary glands, is housed in the floor of the mouth between the sublingual fold, mucous membrane of the oral cavity, superiorly and the mylohyoid muscle inferiorly. This almond-shaped gland lies between the genioglossus muscle medially and the sublingual fossa of the mandible laterally. Posteriorly, it is in contact with the submandibular gland. Ducts from the sublingual gland may open into the oral cavity as tiny excretory ducts, ducts of Rivenus, on the surface of the plica sublingualis located in the sublingual sulcus. Some ducts may unite to form the sublingual duct of Bartholinel, opening into the submandibular duct. The vascular supply to this gland is derived from two sources, the sublingual artery from the lingual artery and the submental artery, a branch of the facial artery. Coelography. Sometimes the ducts of the parotid and submandibular glands become obstructed. After injecting the duct with a contrast medium, a scialogram, a special type of radiograph, may be taken to visualize the contents of the duct. Autonomic innervation. Secretomotor innervation to the salivary glands originates in the facial nerve, cranial nerve 7, and is transmitted to the submandibular ganglion via the chorda tympani. Postganglionic fibers are transmitted to the glands via the lingual nerve, a branch of the trigeminal nerve. Cranial nerve V3T vasomotor innervation originates in the carotid plexus and is delivered via the facial artery. Autonomic innervation to the submandibular and sublingual glands is provided by secretomotor fibers originating in the facial nerve. These fibers are transmitted to the submandibular ganglion via the chorda tympani branch of the facial nerve and onto the lingual nerve of the trigeminal nerve. Sympathetic innervation, vasomotor, is provided from the superior cervical ganglion via the carotid plexus, whose nerve fibers are transmitted to these two glands by the facial artery. Innervation. Two cranial nerves may be observed coursing through the submandibular region. The trigeminal nerve is represented by two branches from the mandibular division. The other cranial nerve is the hypoglossal nerve serving the tongue musculature. Trigeminal nerve. The mandibular division of the trigeminal nerve, cranial nerve VT, innervates muscles of the first pharyngeal arch autonomic fibers to the salivary glands and taste sensation to the anterior 2/3 of the tongue, both from cranial nerve 7, travel on the lingual nerve to reach their destinations. The lingual nerve also provides general sensation to the anterior 2/3 of the tongue, gingiva, and adjacent mucosa. The trigeminal nerve is represented by branches of its mandibular division in the vicinity of the submandibular region. Arising from the inferior alveolar nerve, just before that nerve enters the mandibular foramen, is the mylohyoid nerve. This nerve courses inferiorly in a groove on the deep surface of the mandibular ramus to reach the mylohyoid muscle, which it supplies with motor innervation. A small branch continues along the superficial surface of the mylohyoid muscle to supply motor innervation to the anterior belly of the digastric muscle. The lingual nerve arises from the posterior division of the mandibular division of the trigeminal nerve within the infratemporal fossa. Here it is joined by the chorda tympani, a branch of the facial nerve, carrying special sensory fibers for taste and preganglionic parasympathetic fibers for the submandibular ganglion. The lingual nerve courses anteriorly between the mandible and medial pterygoid muscle, obliquely across the styloglossus muscle, and then into the submandibular region. It next passes between the submandibular gland and the hyoglossus muscle and over the submandibular duct to the tip of the tongue, where it provides general sensation to the anterior two-thirds of the tongue as well as the adjacent mucosa and gingiva. Special sensory fibers transmitted to the lingual nerve from the chorda tympani are distributed to all the taste buds on the anterior two-thirds of the tongue, with the exception of the taste buds of the circumvallate papilla, which are supplied by the glossopharyngeal nerve. The submandibular ganglion, suspended from the lingual nerve by short filaments, lies on the hyoglossus muscle in the vicinity of the posterior margin of the mylohyoid muscle. In this position, this parasympathetic ganglion is in close association with the submandibular gland. Preganglionic parasympathetic fibers from the chorda tympani leave the lingual nerve and enter the ganglion to synapse on postganglionic cell bodies. Postganglionic fibers exit the ganglion, some to enter the submandibular gland, and some to re-enter the lingual nerve for distribution to the sublingual gland and minor salivary glands of the oral cavity, providing them with secretomotor innervation. Hypoglossal nerve. The hypoglossal nerve, nerve 12, provides motor innervation to all of the muscles of the tongue, with the exception of the paladoglossus muscle. The hypoglossal nerve exits the cranial cavity through the hypoglossal canal to make its way to the tongue musculature. In its course, it passes anteriorly across the external carotid and lingual arteries, remaining above the hyoid bone and lying deep to the posterior digastric and stylohyoid muscles. It continues forward along the genioglossus muscle to the tip of the tongue, providing motor innervation to all of the muscles of the tongue, except the paladoglossus, as described previously. Hypoglossal nerve injury. Difficult third molar extractions and or fractures of the mandible may damage the hypoglossal nerve, cranial nerve 12, causing paralysis of the tongue on the affected side. When the mouth is opened and the tongue is protruded, the genioglossus of the unaffected side will cause the tongue to deviate to the affected side. If the damage is prolonged, the tongue muscles will atrophy near the posterior border of the hyoglossus muscle. Branches communicated to the hypoglossal nerve from the first cervical nerve leave the hypoglossal nerve to pass to the thyrohyoid and geniohyoid muscles, providing them with motor innervation. Nerves to the posterior one-third and root of the tongue are derived from branches of the glossopharyngeal and vagus nerves, respectively. Vascular supply. Branches of the lingual and facial arteries provide vascular supply to the submandibular region and floor of the mouth. Vascular supply to the submandibular region and the floor of the mouth is provided mainly by the lingual and facial arteries. Other contributions of minor importance provide vascular supply to those structures originating outside the region or located on its periphery, including the occipital and posterior auricular arteries, serving the posterior digastric and stylohyoid muscles, and the mylohyoid artery from the inferior alveolar branch of the mandibular portion of the maxillary artery, serving the mylohyoid muscle. Lingual artery. The lingual artery arises from the external carotid artery and passes deep into the submandibular triangle to enter the tongue, coursing to its tip. On its way, it provides several branches that supply the suprahyoid structures and the substance of the tongue. The lingual artery arises from the external carotid artery, usually near the greater cornu of the hyoid bone. Sometimes, however, it arises in common with the facial artery, and that common vessel is known as the linguofacial trunk. The lingual artery passes deep to the posterior digastric, stylohyoid, and hyoglossus muscles to ascend to the tongue, turning anteriorly as it courses to its tip. During its passage, it gives off the following branches: suprahyoid, dorsal lingual, sublingual, and deep lingual arteries. The suprahyoid artery arises near the hyoid bone and, while staying cranial to it, supplies most of the muscles attaching to the hyoid bone. The dorsal lingual artery arises deep to the hypoglossus muscle and ascends to the posterior dorsum of the tongue to supply the palatoglossal arch, mucous membrane of the tongue, palatine tonsil, and some of the soft palate. It freely anastomoses with other vessels in the area. The sublingual artery arises at the anterior margin of the hyoglossus muscle to course between the genioglossus and mylohyoid muscles on its way to the sublingual gland, which it supplies along with other nearby muscles in addition to the mucous membrane of the floor of the mouth and gingiva. This artery anastomoses with the submental branch of the facial artery by branches piercing the mylohyoid muscle. The deep lingual artery is the terminal of the lingual artery lying immediately deep to the mucous membrane of the inferior surface of the tongue. It lies lateral to the genioglossus muscle and is accompanied by the lingual nerve. Anastomosis is accomplished with its counterpart of the opposite side at the tip of the tongue. Facial artery. The facial artery arises from the external carotid artery to ascend to the submandibular triangle to supply the submandibular gland. Before crossing the mandible to enter the face, it provides several branches to structures in the neck and to suprahyoid structures. Sublingual artery damage. The sublingual artery, occasionally injured during dental procedures, may present problems to the surgeon attempting to ligate its source because it may arise from the submental branch of the facial artery rather than from the lingual artery. The facial artery, at first, it ascends deep to the posterior belly of the digastric and stylohyoid muscles and passes through the substance of the submandibular gland before crossing the lateral border of the mandible to enter the face. Four named branches arise from this artery as it courses through the neck: the ascending palatine, tonsillar, glandular, and submental arteries. Particularly important to this description are the glandular and submental branches. Glandular branches arise from the facial artery as it courses through the submandibular gland, which these branches supply. Postganglionic sympathetic fibers enter the gland via these branches of the facial artery as it courses through it. The submental artery arises near the anterior border of the masseter muscle, after the facial artery has exited the submandibular gland but before it ascends to enter the face. The submental artery courses on the mylohyoid muscle, which it serves, in addition to providing branches to the anterior belly of the digastric muscle. A deep branch perforates the mylohyoid muscle to anastomose with the sublingual and mylohyoid arteries. At the symphysis menti, a branch of the artery ascends craniate onto the face to anastomose with the inferior labial artery. Veins. Several veins drain the tongue and sublingual area, including the deep lingual vein that is visible on the ventral surface of the tongue. These veins drain into the facial vein or directly into the internal jugular vein. The tongue and sublingual area are drained by several dorsal lingual veins and a large deep lingual vein visible on the ventral surface of the tongue. These veins may empty directly into the internal jugular vein or may drain into the facial vein, along with the submental and sublingual veins. Lymphatics. A considerable amount of lymph drains into the submandibular/sublingual area. Lymph from the tongue is drained through several nodes. Submandibular nodes drain the nose, lips, gingival, and part of the tongue. Efferents from these and from the submental nodes pass through the jugulodigastric lymph node, the principal node of the tongue, which is located close to the bifurcation of common carotid artery. Several lymphatic channels drain the submandibular/sublingual area. The lymph vessels of the tongue drain into the submandibular region, with nodes located along the posterior digastric and omohyoid muscles. One node of particular importance, the jugulodigastric lymph node, known as the principal node of the tongue, lies in close association with the bifurcation of the common carotid artery. Submandibular nodes, located beneath the mandible in the submandibular triangle, drain that area, including the nose, upper lip, lower lip, gingiva, and the part of the tongue. Efferents from the submental and submandibular nodes pass into the jugulo-omohyoid lymph node of the deep cervical nodes and eventually into the jugular trunk before emptying into the subclavian vein.
Don't stop.